5 checkups that I believe every woman should have in their lifetime. Hello my dear ones, how are you? I hope you're doing well despite all that is happening in Kenya currently. So one of them, and I think I've talked about it enough on my channel, is cervical cancer screening. 10 women die in Kenya every day because of cervical cancer. So sijui kwa nini hujaenda kuangaliwa. So cervical cancer is one of the major killer diseases among women in Kenya. So make sure that you go and get your screening, and screening for cervical cancer it's between 25 to 49 years. So depending on which facility that you go, you may get HPV test or VIA, which is visual inspection with acetic acid. Second checkup that you should do as a woman is high blood pressure. And we have rankings in terms of the killer diseases, and cardiovascular is actually the top one, and then non-communicable diseases come second. So cervical cancer is one of the non-communicable diseases. So cardiovascular diseases come first, and one of the cardiovascular diseases that you need to get checked for is high blood pressure. It's actually known to be a silent killer. You may just be going on with your life out here, and then one day you start getting weird headaches, or fatigue, and then the next thing you rush to the hospital, there's a stroke or something that is even worse than that. We've been actually hearing those stories more often, and actually it's happening in younger women more oftenly. So in older days you'd actually hear someone with blood pressure, maybe they're over 50, 60s there. But right now, even people at their 30s, they're still getting blood pressure. So normal blood pressure should be 120 over 80. So 120 is the systolic, which is the upper limit, and then the lower limit is 80, which is the diastolic. So get your blood pressure checked so that you may live a healthy life. That checkup that you should actually go for as a woman, again, is HIV and STIs. I think actually we've been hearing people talking about this so much in Kenya, and there is this hospital, I think it was AHF, this is not sponsored, I'm not so sure whether still they are running the offer for testing of STIs. So the other thing that should actually go for, and this could be an annual checkup, is STIs and HIV infection, basically so that you can know whether you have a risk or you might actually be already exposed, because some of them you might actually be having them at asymptomatic stage, which means there's no symptoms and you can actually pass it on to someone else without knowing. So make sure that you get your HIV and STI checked. Fourth one I would like to highlight is diabetes, and diabetes has 3 types. There is one that is called type 1 diabetes and type 2. So type 1 diabetes occurs mostly in adolescents, children, or young adults. So basically this is a type of diabetes that is normally genetic, so it can be passed from one family, close family member to another. Then type 2 diabetes is the one that is normally triggered by lifestyle issues, that is being obese or having high blood pressure. So basically this type of diabetes of course occurs a little bit later at the stage of your lifetime. And then the other one is gestational diabetes that normally happens during pregnancy, which can also be managed as well. So all these types of diabetes, you still need to go to a clinic. But before you go to a clinic, what are some of the symptoms that can alarm you or tell you maybe I need to have my blood sugars checked? One of them is frequent urination, excessive thirst, excessive anger, and even having frequent urination as well. I think I talked about frequent urination. So frequent urination, excessive anger, excessive thirst, those are some of the symptoms, but still you need to go to doctor's clinic to get your sugars checked so that they know whether they are normal or there is something that is out of the normal ranges for blood sugar. Lastly, or the 5th type of checkup that you need to do as a woman is breast health checkup. Why? Remember we talked about cervical cancer at the beginning as number 1. So breast and cervical actually go hand in hand. Cervical is leading in mortality, breast comes second, but in terms of incidence, which means the cases that happen, is that it actually differs in that breast comes first and then cervical cancer comes second. So breast examination, or rather some of the examination you can actually do at home is self breast examination, which you can do 1 week after your periods. And this is basically using, I think actually I did a video on self breast examination. I'm gonna link it for you on how to do the self breast examination. For women who are above 40, you can also do CBE, that is clinical breast examination, that can be done by a clinician at the hospital. So there are actually methods that you can do at home, and also others that need to be done by a clinical or rather clinician, that is. So those are the 5 checkups that I believe every woman, whether you're in Kenya, in Africa, other African countries, that is, and Europe, America, whichever place really, you should actually have those checkups done in maybe once a year or so, depending on the guidelines. Yeah, so that you can just know your status honestly, because most of these diseases can actually be prevented if they are caught early. So make sure to go and get your breast, cervical, hypertension, diabetes, and STIs for your health. So let's live a healthy life. That is one less worry, actually, among other things that are happening in this country. See you on the next one. Mwah.